but I want to be real clear on this one, especially when you talk about the gut and Crohn's and colitis. I know that in and out. This one is a much more, I think, difficult for you as a patient to deal with, or your husband, and also difficult for me to answer, but I'm going to give my best shot. So number one, nowadays, there are a lot of tests out there that test for circulating cancer cells. So there's a book that, give me one sec, I'll grab my phone and I'll tell you what the name of the book is. It's the Metabolic Approach to Cancer, I believe, Metabolic Approach to Cancer. I really, really like, there's two of them, actually. I'm going to give you two names because if you really want to dive deep, everything you need is in these books. One is the Metabolic Approach to Cancer, and the other one is The Cancer Revolution by Lee Aaron Connolly. Those two books will talk about all these specialized tests that I think even in the UK you can get that are not widely available. One is about circulating cancer cells. So you can actually predict, are there still cells circulating in the body? And that really helps you to gear treatments, because if they're not circulating in the body, it's probably localized and very safe to keep doing what you're doing. And if there is circulating cells in the body, then you know you need to be more aggressive. So that's one of the cutting edge tests. And again, I don't know the lab, but those two books would have references to exact lab testing. Number two, nowadays, at least in the US, and I bet you could find UK, we have places that are doing whole body MRIs. I just had one a year ago in LA, and there's about maybe, the site that I used was, oh, this will come to me too, the name of the company in a second. I'm sure that'll come to me. And you can go and get a full body scan and then see if there's any cysts or changes in tissues all over the body. And I feel like this is the cutting edge of what we're going to be doing in the future for all of us who want prevention. So the circulating cancer cells, and those are just so far above an actual test for just PSA. So knowing that will help you guide treatment. And then nowadays, there's so many places. One of my favorites that I've actually been to is Santa Viva in Mexico. And they actually have really cutting edge ozone and IV therapies and biophoton therapies. And so kind of all aspects, including incredible food, the more biophysical kinds of things, and then also the IVs and nutrition. So if you really got into a tough spot with your therapy right now, you could go somewhere like that and get much more aggressive treatments that were a little bit more natural and prone to less side effects.
Okay, awesome. Thank you so much for that. Okay, another question that had come in is, how can patients incorporate principles of functional medicine into their daily lives to improve their resilience against chronic illnesses?
So I love to start, this can be so overwhelming. And one of the things I love to talk about, but can be very depressing, is environmental toxic load. And the truth is, this is exponentially increasing the chemicals in our water, in our air, in our food supply every year. And so if we're not deliberate about what inputs we put into our body, we are behind the game. And so I do love to talk about this because it's very doable for most of us. And it's just the idea of clean air, clean water, clean food. Sounds simple. And what you can do is, just because it's way more important to put those inputs, the basics of your everyday life and habits and lifestyle, than it is to take thousands of dollars of supplements, even though that's also can be a good thing. So I love starting with the practical inputs, which is clean air. 80% of our environmental toxic load is in the air that we breathe. So making sure at home, maybe in your car, maybe at work, you have an air filter or some way to filter. You want a high quality HEPA filtration system. But nowadays, my recommendations are something with a VOC filter as well. VOC is volatile organic compounds, and those are 2.5 microns or below. So it's like the fumes, the smoke, the off-gassing materials, even exhaust from the roads outside your house. And so you really want a good HEPA filter with a VOC filter. The top three brands, there's probably others that I know out there, are IQ Air is excellent, Air Doctor is excellent, and Austin Air. Those three are fantastic and phenomenal. There's probably more, but those three have a HEPA filter with a VOC filter. So air quality, clean air, clean water, making sure you have filtered water in your house. It's a very, very basic thing. I live in a condo, so it's hard to install the big whole house filters, but at the very minimum, I have a really good quality fridge filter that will filter out that water and all the 200 plus chemicals that can be in there. So you don't want to be drinking tap water, and you want to avoid plastic water bottles whenever possible, because those are leaching that BPA. Even if they're BPA free nowadays, I think any plastic is dangerous. And then clean food. And this is where you choose to put your money towards the best quality that you can. And if you can't afford all organic, you want to at least go with the dirty dozen that are most commonly sprayed with pesticides. You can find that list every year on Environmental Working Group .org, and they list the top sprayed foods with pesticides. So if you just can't afford all organic, at least you buy those foods like strawberries and celery and peppers are always on that